Hey guys, I want to talk to you a little bit about pain after rhinoplasty. Actually, more specifically about what we do at Nyack Plastic Surgery to minimize or entirely avoid pain after rhinoplasty. So pain after rhinoplasty, I think, comes down to a couple things. It comes down to not preparing the brain adequately during the surgery to have a pain-free experience. It comes down to packing, and it comes down to not doing the right things after surgery on the patient's end to minimize the amount of pain and minimize the amount of stimulation that you have. So let's talk about those three things specifically. So first off, we want to minimize the brain's tendency to feel pain post-operatively. Now, how can we do that? It has been well demonstrated that when you are having your surgery, even though you're asleep and don't know what's going on, if you're under general anesthesia and your brain is deeply asleep but your body is feeling pain, your brain gets primed to experience pain later. It almost becomes practiced at pain because it's feeling it while you're asleep. And so then after surgery, anything you feel seems more painful. So the first key to minimizing pain after rhinoplasty is during the surgery, making sure your surgical team does the right things to keep your brain from experiencing pain on an unconscious level. So we call that, we want to diminish, or we want to avoid the nociceptive windup. All right, so that's part one, and that requires the surgeon and the anesthesia provider during surgery to go through special techniques to make sure your brain doesn't feel pain even though you're asleep. All right, part two is packing. So why do we pack the nose? In my practice, I don't pack the nose with a rhinoplasty. The only time I would pack the nose is if there was bleeding that I couldn't control any other way, and then I would pack the nose to stop the bleeding. How often has this happened since I went into practice in 2004? 0 times. So I have packed no rhinoplasties, despite doing 80 to 100 a year, packed no rhinoplasties in the last 14 years. There are other ways that I can use to minimize bleeding. There are other ways that I can use to hold everything in place. And so although it makes the surgery take a little bit longer, I can totally avoid packing the nose. And packing is very uncomfortable. It's uncomfortable to have in, it's uncomfortable to wear in for 4 or 5 days, and it's uncomfortable to have it removed. So if we can avoid it, all the better, less pain after rhinoplasty. The third thing is things that the patient can do to minimize pain after rhinoplasty. And the big one there is build a foundation. So we recommend all of our patients build a Tylenol Foundation where they take Tylenol around the clock for the first 2 days, and we recommend no more than 3,500 milligrams of Tylenol in a 24-hour period. That's about the safe maximum. So what does that mean? It's about 2 regular strength Tylenol every 4 to 6 hours, no more than 11 in a 24-hour period. So we have you build a Tylenol Foundation. With that Tylenol Foundation, very few people, if we've done the other steps correctly, need to take any additional pain medicine. We also do one more thing on our end. We inject very long-lasting numbing medicine at the end of surgery so that the tissues are numb. So if the area that we worked is numb, your brain's not primed to feel pain, you're taking your Tylenol Foundation, you're not packed. Between all those things, the chances that our patients take pain pills the first evening are under 50%, and almost nobody takes pain pills starting the morning after surgery. Of that pain, people tell me it's stuffy, it's sinus headachy, it's not misery. So again, if we do all the right things, the chances that you take pain pills are 50% or fewer the first evening and almost 0% starting the next day. And the great thing about not taking pain pills or taking very, very few of them is if you don't take pain pills, you can't get pain pill side effects. Can't get nausea, can't get constipation, all the mental side effects of pain pills. So our goal is to make it a pain-free experience, a good experience, and we put a lot of thought and effort into making that happen.